Hi everyone, I'm Stephanie with 9 Health. This morning we are talking about the Safer at Home order, slightly relaxed, slightly loosened to our stay-at-home order that the state had. A lot of counties have extended the stay-at-home, however, to May 8th. Some have looser restrictions. It's all kind of confusing. You can find everything listed by county on 9news.com, but I'm also joined by two experts today to hopefully clear some stuff up and just talk about what things may look like from here on out. I'm joined by 9 Health expert Dr. Payal Kohli and the man Governor Jared Polis refers to as Colorado's Dr. Fauci. That's what Kyle Clark called you last week too, so I'm gonna keep going with it. Dr. Jonathan Samet, he's Dean of the Colorado School of Public Health and also an epidemiologist on the CU Anschutz Medical Campus, and he works with a team that creates the models that are helping to guide what our state is doing, the decisions that we're making right now. So first, thank you both for joining me. And Dr. Kohli, can you start with an update on COVID-19 in our state today?
So as the governor shared with us in some of his graphs yesterday, we've had a decline in the growth rate of hospitalizations over the last week or so. And that's been one of the primary driving forces in him making the decision to change from a stay-at-home to a safer-at-home order. More nationally, we're probably going to hit a milestone today, which is we're going to cross about 1 million cases in the United States. It's certainly a sobering moment. And we've also heard nationally that some of the models and estimates for the death rates have actually been revised based on the IHME model, or the University of Washington model that the White House has often been referring to. Initially, they had said about 60,000 deaths by August, and we've already hit 55,000. So they're actually going to revise those upwards. And they're saying some of the reasons for their revisions are that states have started loosening some of the social distancing, and maybe that's causing more of a spike. And they're also seeing more hotspots than they had initially put into the model. So I'm very excited to hear about Dr. Samet, who's Colorado's Dr. Fauci. I want to see if he does his voice as well. But I would love to hear about how our model here in Colorado is performing based on the tests that we're actually doing. Since we do know that models are never as good as real world data, but certainly they do help guide important decisions.
Yeah, Dr. Samet, if you want to just answer that and explain what you do and how you got involved with creating the models.
Sure. So, happy to give you a brief overview of the work that a very large and talented team has been doing. So my own background, as said, was in epidemiology and actually pulmonary medicine as well. And I've been involved in many different sorts of modeling exercises. But with this pandemic, we needed a model tailored to Colorado that would give us insights into what's happening here, that we could use to flexibly look at different scenarios that the policymakers may want to consider. So roughly a month ago now, we started working together, a team that comes from the University of Colorado, our different schools, and also CSU, and have developed and continually refined a model that tells us about Colorado.
Yeah, so talk a little bit about, just elaborate on what the model is showing and where things are going to go from here. People are commenting on our Facebook page. Again, if you have questions for these two, I'll pass those along. But people are saying without enough testing, how can the models be correct? So maybe talk a little bit about how you kind of predict the future right now.
Right. So I have to say one thing: no model is correct. So let's start with that premise. And there's a famous quote that says, "All models are wrong, but some are useful." And our model initially, we really focused on that initial peak and how big it would be, what would happen in relationship to healthcare. Now we've focused on looking at the longer run. And when the governor announced safer at home, a little over a week ago, some of that came from our look at different scenarios of what we need to do to keep the epidemic under control. Safer at home is not the same as back to normal. And I think the governor has emphasized that. And our models show that unless we do some degree of social distancing at a pretty high level, and we do case identification and isolation, and we wear masks, and we encourage those who are vulnerable to maintain social distance, the older people, people with underlying conditions, we could end up with a peak we can't manage. Part of that story is that our initial social distancing worked. So most of us had not become infected, perhaps a few percent at most. And what that means is most of us are still susceptible. So we have to be careful to avoid that second peak. You know, the question of testing is a critical one, and we're now working on expanding the contact tracing. This CDPHE, our state health department, and the local public health agencies are all working to expand case identification, contact tracing. We need more tests. That there's no doubt. But our models show if we start ramping up, we can keep things under control.
I know Dr. Kohli has to leave us in a few minutes at 11. I wanted to ask her as well. We're talking about safer at home, and Dr. Samet just said, this isn't really returning to how things were, but can you give advice maybe for those that had to return to work this week, some safety measures they should be taking as they maybe are leaving their homes more than they did last week and are forced to go back to work?
I think I would echo what Dr. Samet said about wearing the mask. And the more of us that don't wear the mask when we leave our homes, the longer this is going to take for us to get back to our lives. And the more deaths we're going to have, the more spread of the virus. So my first piece of advice would be everybody needs to wear that mask. And I have been a little bit disappointed, honestly, with the number of people that I've seen when I've gone out and about that are actually wearing the mask. So especially as you're going back to work, I know it's not comfortable. I know it's not easy. But trust me, it's for a good cause, and it's important to have that mask on. The second thing I would say is be really cognizant of common areas at work. So we are certainly going to decrease the number of employees that are present in the office at any given time. But having said that, common areas such as the cafeteria or the lunchroom, where people are sitting, they usually have to take off their mask because they're eating. And so they're certainly exposed to any droplets. And many people are going in and out. Be careful that you're sitting, firstly, I would say at least 12 feet apart. And I know we talk about 6 feet, but when you're talking about a closed indoor space, most of which has ventilation systems, what some of the studies from China have showed us is that the air conditioning and the drafts and such can actually carry respiratory droplets a lot farther than 6 feet. So a lot of people are saying, let's double that distance to 12 feet and see if that can be even better. So try to space as far apart as you can when you're at work. And be really, really cognizant about close contact, especially with surfaces, because we think the primary mode of transmission is person to person, but what's called fomites, or surfaces that can spread the virus, such as doorknobs, handles, telephones, those types of things that we commonly use at work and don't necessarily always get cleaned. Just be really cognizant of that. And I think, we've been really primed with very good information over the past several weeks. So I'm confident that as people return to work, they are going to be following many of these precautions, not touching their face, wearing their mask, maintaining the distance, and not touching surfaces.
Yeah, and someone did just ask on Facebook, they remember us saying, don't wear a mask, don't go out and get a mask, don't waste the masks, kind of thing. And there's been so much flip-flop and a lot of confusion. And even with the safer at home orders kind of lifting, there's just a lot of confusion out there. Maybe talk a little bit about the change in masks, why that happened again.
Yeah, so this is a great question. And it's the science is still the same. What's changed is the virus and how fast it's spreading and what we've learned about the virus. So before we were saying don't wear masks because they don't offer you that much protection. All we know about masks is that they're very good at filtering the large respiratory droplets, but the simple surgical masks or homemade masks don't actually filter the small droplets from getting in. So they don't offer you much protection. The reason we're now saying to wear masks when you go out is not as much to protect yourself, but it's more to protect others, because what we've realized is that there are a lot of asymptomatic or minimally symptomatic spreaders. So there are a lot of people who are spreading the virus and not realizing that they're spreading it. And so the masks are very good at preventing those droplets from getting out. And so if everybody wore masks, just like if everybody does social distancing, that's the only way that it works, because then even those people that are asymptomatic or minimally symptomatic are keeping their respiratory droplets kind of close to their face. They're not letting them get out to infect others. So before we were saying don't wear masks because they don't protect you. Now we're saying wear masks because they protect others.
Yeah, thank you for clarifying that. And Dr. Samet, I wanted to ask you about, masks, testing, the model that you have going forward. Can you talk a little bit about what that shows as far as the next coming months and into the fall?
Sure. So, a couple of things. I mean, I just want to go back to masks for a minute. We have built masks into the modeling, and they work, but just to reemphasize the point, they don't work if they're not worn. And, that figures very much into the model of how well masks will work. We all have to use them. I think strategies, I think as Dr. Burke said, nationally, we are into social distancing for months to come, into the fall and perhaps beyond. We really don't know. But I think as we move on, remember, two kinds of testing that we're talking about here: testing to identify those who have the virus, who are infected with the virus. And then as we move into sort of the longer run, we're going to need to know who has had the virus, has antibodies to it, and is hopefully immune, although long-term immunity remains to be determined. So we're going to need both kinds of testing, and any strategy of case identification and contact tracing is going to have to rely on the ability to have enough tests available. And when I say that, that means they have to be all over a very diverse and large state where we can provide the tests, get the results analyzed, and get the results back to public health and individuals. So we still have a lot of work to do in that regard.
And the models that your team has come up with, those included the testing that we don't really have yet, correct?
Well, they don't include the testing directly. They
Okay.
include case identification, and they're going to build in the contact tracing, and testing is inherent to doing that.
And going forward, do you think that the governor decided to relax restrictions slightly to safer at home just because initially health leaders were saying we would need the testing in place before we changed from a stay-at-home order? So why do you think the change there? Is it because the widespread testing is kind of far off at this point, so safer at home is a more sustainable way of living right now?
I think the governor's taken a very measured step. And I think, again, just going back to what it is, it's opening workplaces to a degree. I think there's important comments here. There's responsibility both on individuals and the employers to provide a safe workplace. So they have to be ready. We're at our campus working very hard on procedures to get people back to working in offices, how to provide space, how to make sure that no one is coming in who is ill. So, again, the testing is part of that. The steps that the governor has taken, if we don't overshoot as a public on relaxing our social distancing, if we do the other measures, our models would say we should be okay. But everything, in a sense, has to work. We all have to do our part.
And talk about the level of social distancing that we will need to maintain, how that compares to what we have been doing.
Right. So I will say one thing: we're getting a better handle on what social distancing means. Our team, working with others, is looking, for example, at the cell phone information to understand how much we're moving about. I actually think what we see over the next couple of days is going to be really important. We achieved a level of 75, 80% reduction from where we had been. And we feel we can lighten up in the range of 15, 20%. It's a little hard to translate that exactly into 50% of people returning to work. It's a marginal step, it's a measured step. And now we just have to watch incredibly carefully for what happens. We have to watch the mobility data, of course, hospitalizations and everything else, but we don't want the epidemic to get out of hand.
Right, and the social distancing that we did, it worked, right? It flattened the curve.
It flattened the curve, it smashed the curve down, and we avoided a peak where our capacity to provide care would have been exceeded. I mean, that said, of course, we experienced deaths, as has the nation, from COVID-19. And unfortunately, we can't put an end to that yet.
Someone just asked on Facebook, as we relax some guidelines and some restrictions, is limited exposure to the virus good for immunity? So talk, maybe as an epidemiologist, talk a little bit about immunity to COVID-19, what
Right.
we know so far.
Well, I think there's two questions. I mean, one is, are those people who've had the infection immune for life, as happens with some infections? That we don't know yet. And apparently with some coronaviruses, we can have multiple infections, those that cause the common cold. The antibodies for those who had SARS, the coronavirus caused epidemic in 2003, apparently the antibody levels did decline over time. So, if until there's a vaccine, some of us will be infected. As more and more people become immune, perhaps we'll head towards having so-called herd immunity. That means enough of us are immune so that the virus can't propagate as an epidemic. But that level's way off. There we're talking about 70–80% of people having been infected.
And we talked about the vaccine, talked about testing. I'll let you go here in a minute because I know I told you 15 minutes, but we did just get another question about the vaccine and testing. Ultimately, we'll never be safe without a vaccine, she says. What does testing really accomplish? Maybe explain how testing.
Well, it's a key part to control. And if we can't identify those who have the virus, then we can't manage them. We can't use the basic fundamental mechanisms of isolation and management, contact tracing. So we need the testing to be able to do that. If I can I do a little bit of advertisement about a series we've put together? The School of Public Health has been collaborating with the Denver Museum of Science and Nature and its Institute for Science and Policy, putting on a series for the public on the COVID-19 epidemic. 8:30 on Monday morning. I led off yesterday talking about many of the things that we've been talking about here now. Next week's is on vaccines and treatment. So for those of you wanting an update, 8:30 in the morning, and go to the museum's website. We are trying to arrange that the next session would be on testing. So, again, this is all in the works, but we want to put out the facts from the experts because everybody, of course, wants to know about everything, and we should.
Yeah, I mean, it's a new virus. It's all still very new. The research is all very new. We don't have a ton of data yet, so we are all kind of learning as we go. And like you said, the models are our best guess at what's going to happen for the future.
That's right. That's right.
I do have a little advertisement as well. If you have any more health questions, you can call our 9 Health Neighbors line, 303-698-4455, extension 2005. You can reach a 9 Health medical volunteer, leave a message, a 9 Health medical volunteer will call you back within 24 hours. It's just a way to talk to a person. You can post more questions in the comments. I can get those answered for you by Dr. Kohli or Dr. Samet after the fact as well. But again, the 9 Health Neighbors line for your health questions. And if you know any neighbors that don't have access to Facebook Lives like this or the internet, 303-698-4455, extension 2005. I'll post that in the comments. I'll also post links to a couple stories that 9 News has done recently. One about the different counties and the rules and restrictions right now, because several counties have extended their stay-at-home orders to May 8th. While some have looser restrictions. And then also linked to the story with Dr. Samet that they did last week that shows some of his modeling as far as where we go from here and what the future holds. Dr. Samet, I want to thank you so much for joining us. I will let you go. We will sign off from here. Thanks so much.
Okay, thanks, Stephanie, for the opportunity to talk. Bye, everyone.